Pharmaceuticals major industry in New Jersey. Should the federal government regulate pharmaceutical drug prices?
I cannot say as emphatically as this, but absolutely yes. Other nations have common sense rules that you cannot charge in our country for the same drug 5x, 2x, 100x what is being charged in other nations. We should do the same thing here. And for those companies that violate that, we should take away their patent and allow other generics to come in. And what's more insulting about our nation is that our common taxpayers, we pay for so much of the research that often goes into these drugs. So we're paying doubly when these pharmaceutical companies do this. And you see insulin.
Would setting the prices affect that research?
No. And a lot of these people, they're the worst abusers of jacking up the prices of drugs, 100x, I'm not exaggerating these numbers. Often the companies didn't originate the drug. They buy it for these innovative biotech companies that design the drug, then it gets bought up from the big guys. And so, look, the business model works. You do not need to profiteer off of people's pain. We have a nation right now that seems to be content on allowing this kind of corporate malfeasance to go on, and then we pay for it multiple times, because I know folks who ration their insulin, for example. And you know what happens? They end up in emergency rooms. And then we pay again for healthcare costs. That to me is an immoral system, and it's not an economically necessary system. We should do something about it. And it just goes to the larger
theme. Should they be prosecuted? If you were president, would you have your Justice Department go after the pharmaceutical companies? You look at today's front page of the Washington Post, a deep dive into the opioid crisis and how certain drug companies profited.
My Department of Justice will go after these folks, these pharmaceutical companies that have been fueling this opioid crisis, where it was an intentional strategy to juice the addiction of Americans to this drug, causing our life expectancy as a nation to go down. This is criminal behavior, immoral behavior, and my DOJ will go after it. But I want to go deeper than that, because just you glanced on something that makes my larger point. We have become comfortable as a society paying an egregious amount of money on the back end of problems, when if we understand that the fiscally responsible thing to do is also the morally right thing to do. And I can pick 1,000 examples, but I'll just give you one. I'm a data-driven person. I can go from doula care for low-income folks about driving down healthcare costs and elevating life well-being. But Seattle did this study of what was more expensive, keeping mentally ill homeless people on the street or having them go to supportive housing, which is anybody who's dealt with housing as much as I do, that's expensive housing. What was more expensive? Well, they found that actually keeping mentally ill homeless people on the streets was more expensive. Homelessness was more expensive. Why? Because those folks ended up in jails and hospital emergency rooms. There is a far better way to do healthcare in this country that creates the right kind of incentives. And our system is so broken right now because it's designed around illness and disease and not prevention and early intervention and doing the things that elevate human well-being, elevate economic potential, and minimize the need for hospitals and doctors.